Dr. the Honorable Christopher Tufton, Minister of Health and Wellness, Mr. Everton Anderson, Chief Executive Officer of the National Health Fund, Dr. Kamal Mars, Board Member, distinguished guests all, members of the media, good morning. It's my pleasure this morning to welcome you to this press conference. We're gathered for a significant development in healthcare accessibility as facilitated by the NHF card to be announced by the minister this morning. So on behalf of the board and management and staff, I extend a very warm welcome to all present. Our Minister of Health and Wellness, Dr. Christopher Tufton, he's the bearer of good news, and you'll be having more good news for us this morning. Welcome, Minister. We know you're very busy, and so we are getting underway and moving along very quickly. Our award-winning CEO, Mr. Everton Anderson, dedicated members of the board, special welcome to our stakeholders and to members of the deaf community, and to our interpreter, Antoinette Aiken, this morning. Of course, I would like to take this opportunity to recognize Dr. Leslie Mead, the president of the Medical Association of Jamaica. I think this is perhaps among your first public events as the president, current president. Welcome. We also want to welcome Mr. Stephen Della Penna, who is representing the Jamaica Private Pharmacy Owners Association. Welcome too to the Nurses Association of Jamaica, Mrs. Dawnette Marie Richards, the current president, and also to the immediate past president as well. We are happy to have you. We also want to welcome representatives from the Jamaica Multiple Myeloma Support Group who have joined us this morning. I want to say welcome to you as well, and to all our representatives from our pharmaceutical suppliers. I see Carimed, who came in pretty early. Welcome to you. And also, of course, welcome to NHF managers and staff. Welcome all, ladies and gentlemen. The media, of course, we're very happy to see you as always. Also want to give a shout out to those joining today in cyberspace. I extend a warm welcome to all to this important press conference. And without further delay, let us proceed with the agenda. To commence our program, I'd like to invite Mrs. Catherine Dawson-Shaw, Manager of Individual Benefits and Research, to lead us in a moment of prayer.
Honorable Minister of Health, CEO Mr. Anderson, Board Member Dr. Mars, stakeholders, colleagues, friends, media, good morning. Let us pray. Lord, we want to thank you for this another day that you have brought us to. We are vertical and we are in our right mind. Thank you for your mercy. Thank you for your faithfulness. As we assemble here this morning, Lord, we thank everybody who made a request, who shared their story, who encouraged us, who supported us, who are part of the process in us getting everything together so that we can be expanding our program. As the activity proceeds, we ask that you would be with us today as a part of the journey, and as we continue into the future, we crave your presence and your support and guidance. In Jesus' name, amen.
Thank you, Catherine. Earlier, when I identified Mr. Anderson as an award-winning CEO, it was, of course, because he has been collecting these awards, and the most recent was that of Outstanding Public Sector CEO, which was awarded to him by the Jamaica School of Business at the university on their 19th anniversary. To bring opening remarks, please welcome Chief Executive Officer of the NHF, Mr. Everton Anderson.
Miss Charmaine Robotham, our Master of Ceremonies, Dr. the Honorable Christopher Tufton, Minister of Health and Wellness, representing the board, Dr. Kamal Mars, the wonderful staff of the NHF, our stakeholders, I see my good friends from the NAJ, good friends throughout my entire working life, Dr. Leslie Mead from the MAJ, I see our pharmacy trade represented both at the distributor level and at the dispensing level. Ladies and gentlemen, good morning. We're very happy to be here today. It's really another milestone in the journey that NHF is on. We're in our 20th year, and a lot of hard work has gone into making our programs work. And we've had some significant achievements. It has been a fast-growing organization, moving from 6 persons to 750 persons. Since the start of the NHF, we have enrolled 761,000 beneficiaries. We have funded 850 projects at a cost of $22 billion. We have spent $80 billion through drug-serve pharmacies to make medication available to our population. And on the NHF card program, we have spent in the region of $64 billion through our provider pharmacies. And for the drug-serve program, we are very proud that we were at under 1 million prescriptions when we took over the process, and we are in the 3 million mark now. So I say this to say that I think the staff deserve a round of applause for their work. With turning 20, there has been some amount of reflection on the journey. And we went back to look at why the agency was set up. And a key statement spoke to that broad health financing arrangement, making access available to the Jamaican population. And as such, the theme for our 20th year is reigniting the health financing agenda, because we believe that, and I have had this discussion with Minister, that health financing is one of the key planks for the development of any health system. So as we looked at that, we realized that in our 20th year, there needed to be some changes. And changes in our case mean improvements to our offering to the public if we're true to our mandate as an organization. So the team did significant work to come up with a package of benefits, and Dr. Mars is a member of the Medical Review Committee, so she would have had many animated discussions after the submissions by our Senior Director, Mr. Ainsley Jones and Mrs. Catherine Shaw. And we have come up with some new offerings from the NHF. And I think this is very important in the context of a world where the cost of healthcare will continue to rise. And this cost is driven by an aging population. It is driven by higher costs for surgeries, higher costs for diagnostics, and what affects us, and I hope CareMed is listening, and any other distributor, rising drug prices. So in that context, we are committed to providing more from the NHF. So one of the lessons we've learned is that healthcare costs will continue to climb. And that is why today we're here to say that we're carrying out our mandate and we're offering more to the people of Jamaica. I could not come here this morning, though, without commending the board and the minister for supporting our push to have new offerings from the NHF, and in the case of the minister, to embrace also the health financing agenda so we can restart that discussion about how we finance healthcare in Jamaica. So this morning, as I welcome you, I just want to say to you that we remain very committed to providing a good service, to providing our full efforts in pushing the NHF as a key agency for health financing, and working together, the sky is the limit. The minister will officially announce the new benefits, but I am saying to the beneficiaries, use the benefits. It's there for you to use, and I thank the team for working together to get us to this point, and I am sure that many, many Jamaicans will benefit. Thank you. Welcome. Have a good morning.
Thank you. Thank you very much, Mr. Anderson. And I would like to recognize at this point Mrs. Jean Laurie Chin from the Caribbean Community of Retired Persons. Welcome. This is an important group for us as NHF. In fact, the greatest percentage of persons on the NHF card are persons 50 and over. So we are very happy to see you representing that group. And now I'm going to invite Dr. Kamal Mars, a member of the board, to share remarks from the Board of Management on this significant development. Dr. Mars.
Good morning, everyone. Master of Ceremonies, Dr. the Honorable Christopher Tufton, our Minister of Health and Wellness, or award-winning CEO. Yeah, we're never going to stop saying that. Mr. Everton Anderson, senior staff and employees of NHF, stakeholders, the media, guests, and of course, my professional colleagues, Sir President, Madam President. Oh, apologies. Over the past several months, we have carefully evaluated the evolving healthcare landscape, and we've listened to the needs and concerns of all our stakeholders. In response to this, I'm excited to be here today commemorating the addition of several new conditions to the Individual Benefits Program, another life-impacting move by the fund. This is groundbreaking, and what better year for it to happen than in our 20th year. The NHF has been a lifeline for countless individuals and families. As such, the Board of Management continually works to ensure the strategic use of the fund's resources for the betterment of our customers and the efficiency of our programs. I'd like to highlight the Medical Review Committee. It's a 7-member subcommittee of the board, and we're tasked with overseeing the Individual Benefits Program and health-related aspects of the fund's core business. This committee would have undertaken several qualitative and quantitative assessments and considered clinical opinions and expert input to arrive at the decision that we are celebrating today. This move is driven by our commitment to reducing the financial barriers to healthcare for a larger number of people in our country, and is a significant leap in the advancement of healthcare in Jamaica. I truly believe that these enhancements will have a positive and lasting impact on the lives of those we serve. If you recall, we also announced the expansion of benefits in January of this year to add the PSA diagnostic test for prostate cancer, subsidy adjustments for 8 conditions, and new active pharmaceutical ingredients for the NHF card and the Jamaica Drug for the Elderly program, JADEP. While the demand is great, the agency vows to continue making strides in alignment with Vision 2030 and the Ministry of Health and Wellness strategic priorities to achieve greater health outcomes. The NHF card program is non-prejudicial. It's accessible to everyone who is eligible. With this in mind, we have been making considerable operational changes for better service to persons with disabilities in order to reduce barriers to access. I want to specifically acknowledge the presence of those present today. As I close, yes, short always, I want to express sincere gratitude to our dedicated team at the National Health Fund for their unwavering support and hard work in making these and other expansions reality. As we move forward, I encourage open communication and collaboration among all stakeholders to ensure the successful implementation of these changes. Our commitment to excellence remains unwavering, and I believe that this program expansion is a significant step towards a healthier future for our nation. I look forward to the positive impact that these additions will bring to our beneficiaries. The board is excited about the future of the NHF and its contribution to healthcare in Jamaica, and we look forward to answering any questions you may have about these additions to the NHF program. Thank you.
Thank you, Dr. Kamal Mars. She's a very passionate member of the board. Don't be fooled, by how, calm she is. Not only passionate, but dedicated. Despite her, drawback this morning, she is here. If it's even on one foot, she's here. So please, let us have another round of applause for our board member. And I also want to recognize at this point Savoni Campbell. I'm not sure if I have the pronunciation correct, who is representing the Jamaica Association for the Deaf. Thank you very much for coming and for your bringing others with you. Yes, we want to expand and improve our customer service at the NHF. And with the passing of the Disabilities Act, we want to ensure that we are involving and ensuring that persons with disabilities are aware of what it is the NHF is doing, hence the addition of an interpreter and the invitation to persons with disabilities to be a part of what we're doing. Before we proceed further, let's take a moment to enjoy a captivating performance from the Lord Dance Ministry. Put your hands together for them. that was a nice interlude. I want to also recognize, we're having a full house by now, and I want to recognize Dr. Tyrone Smith, President of the Pharmaceutical Society of Jamaica, is here. Welcome, sir. Okay, and I also want to recognize Dr. Alana Langley from the Pharmacy Council of Jamaica. Where is she? Okay, welcome, welcome. I did not recognize earlier our senior directors and directors from the NHF. I want to recognize Ms. Grace Ann Johnson, Senior Director of Pharmacy Services, sitting up front here. Also, Mr. Ainsley Jones, Senior Director, Individual Benefits Research and ICT. He's here this morning. And to the back, our Director of HR, Raquel Morris. Thanks for coming. Good to see you. Now, the moment we have all been waiting for, an address by our main speaker, Dr. the Honorable Christopher Tufton, MP, Minister of Health and Wellness, who will provide insight into the new additions to be added to the NHF card. Please welcome our minister.
Thank you very much, Madam Chairperson. Let me begin by expressing my apologies for the late arrival. Not sure, but I have 5 speaking engagements today. And I was at one Caribbean Moves consultation at the Pegasus next door. I'm not sure why my diary is so crowded today, but I came and you were all happy, so you didn't mind waiting. Is that so? Maybe not. All right, so I apologize. But it's a good occasion, a happy occasion. And I want to begin by recognizing the NHF team, led, of course, by Mr. Everton Anderson at the managerial level, the chair, the board, chairman, who is not here, but ably represented by the lady to my immediate left, Ms. Kamal Mars. Sorry, that is because of the meetings I'm thinking about why I keep forgetting. Madam Chair, thank you, and to the rest of the team here. And there are so many other organizations and individuals here. The MAJ President, Dr. Mead, I don't think we have had an official meeting yet. That's because you didn't send me a letter as yet requesting a meeting, right? Soon. Okay, well, congrats on your elevation, and we look forward to that. Of course, I have seen my nurses. We were together last week. Immediate and current president, Dawn Marie Richards and Patsy Edwards Henry. Everybody knows them, right? There's one thing with that organization. They always accost me on TV, so you must know them once they get appointed. No, we're good friends. To the rest of you who are here representing different agencies, organizations, private, public, I want to just say hello to you all. So this is another happy, you know, I heard Everton's presentation about the achievements of the NHF, and indeed, he's correct. And I think the organization deserves all the commendations for its fulfilling its mandate, being very diligent to its cause, and for efficiently executing that mandate for the benefit of, how many people now benefit from the NHF? About 1 million or close? 800,000? Active, right. And without the NHF, just use your imagination. A lot more people would die, and certainly a lot more suffer, whether in silence or aloud. So it was an idea, a concept, now materialized, that is well worth it, and that has lived true to what it is intended to do. But in a sense, it is a happy, sad occasion every time we have to add another benefit and add another list of drugs and add another service, because it is saying that we are providing, on the happy side, or the positive side, a solution, or attempting to provide a solution to the problems of our society. But it's also saying that the problems keep increasing and increasing and increasing. And finding that balance is the real challenge of our society, and for public health, and for agencies like the NHF, and indeed for the government and for all of us. because the issue is going to be, how do you minimize the pain to maximize the gain? And I know the medical distributors and corporate brands respond ably well to the challenges when they come up. I know it's profitable to do so, and I know they work with us aggressively to bring down cost, and we want to encourage them to do more of that. But we're going to have to, at some point, determine how sustainable it is to be doing this on an ongoing basis. So when Everton spoke about the need for financing reform around healthcare and how it is paid for, who pays for it, it's a very relevant issue. When we speak about primary healthcare and the need for prevention as opposed to the cure, very relevant. And it's a conversation that we must have. Now, that's not on my script, by the way, right? But I just thought I'd mention it because I have a captive audience in front of me. And it is a truth that we must deal with. But today, again, the NHF is rising to the occasion. They have the data. They study the sick profile of our population. They collaborate with the parent entity, the Ministry of Health and Wellness, or epidemiology folks, their own data collection, the demands for drugs, the people who inquire, even when they are not on that list of 17 initially, sick categories. And they tabulate all of that, and they balance that with their ability to afford. The data has to be affordable, and sustainably so. And then there are decisions that are taken around how we move beyond where we are. And it has to be done with a lot of thought and a lot of analysis, because otherwise you could run into a situation where we say we do everything for everybody. So there is access, but the quality of that access is compromised because the drugs are not available. And so you have to work it through all along the commodity chain, and cost is involved in that and availability in that. But so I think from that standpoint, the NHF has done very well. There's a big management process around that to ensure that the deliverables are in place. So today we are demonstrating again another set of variables that demonstrates our responsiveness to the population, providing funding for specified healthcare benefits, health promotion, health projects, pharmacy services in this instance, in a way that is sustainable and patient-centric. The National Health Fund, of course, as an entity, provides benefits and subsidies for three main categories of Jamaican residents enrolled. Subsidies are provided for medication to treat with about 17 chronic diseases, medical supplies and devices for diabetes and asthma, and diagnostic tests. Some 350,000 Jamaicans actively rely on this program for care, and the subsidies are accessed using the NHF card and through the Jamaica Drug for the Elderly program, JADEP. And this is a moving target and requires ongoing review and adjustment. So today it's about 5 conditions which now be added to the existing categories of illnesses where a number of Jamaicans will benefit if they are unfortunate enough to fall in those categories. We don't wish sickness on anybody, but we have to respond. The NHF card will therefore see increased subsidies for the treatment of colorectal cancer, lung cancer, multiple myeloma, Parkinson's disease, and thyroid disease. This represents an estimated 450 million in additional subsidies, and we'll see some 47,000 approximately Jamaicans benefiting from this program. So I think this is a very positive development from the standpoint of our responsiveness but it's also an indication of the challenges we face in the health space within our society. So I want to use the opportunity to commend Everton and his team at the NHF for the responsiveness and for the constant monitoring of the environment to these challenges that we face. We must recognize the magnitude of the disease burden every time we have the opportunity to. That continuously creates the challenges. Now, take cancer. Cancer is a major national health concern in Jamaica. In fact, when I looked at the numbers recently, even though cardiovascular disease is the primary cause of death, the rate of growth of cancers is actually the fastest growing. I won't get into a lecture on that as to why. There are all sorts of reasons for it. It is the second leading cause of death among the growing problem of non-communicable disease. And from a premature death perspective, premature mortality, it is a major issue. When you look at the data, 2020 Global Cancer Observatory lists colorectal, otherwise called colon cancer, lung cancer, and multiple myeloma among the top 10 cancers in the country. Hence, again, the analysis as to why we need to respond. As the third leading cancer among the population, colon cancer affects some 11% of the population, with over 700 new cases recorded in 2020. At the same time, more than 500 people, or just about 7.5% of Jamaicans, were diagnosed with lung cancer. The condition is especially common among men who don't like to go to the doctor and get screened. Again, that's another issue that we have to address. Multiple myeloma, a type of bone marrow cancer, though of lesser prevalence than the two previously mentioned, recorded a 2.9% mortality rate and result in over 100 or so persons in 2020. So these conditions, of course, once you hear the big C, if you don't get so excited that you get a heart attack because it's a scary term, then the treatment, in fact, they say that when you're diagnosed with cancer, you immediately have to plan for 10 million Jamaican dollars of expenditure initially in terms of the treatment because it's expensive. So adding these categories to the NHF card is a major boost to those who fall in that category. Beyond that, of course, is the other critical impact of economic activity, social, environment, and how it affects your families, your friends, and so on. In addition to these 5 additional conditions, we will see 10 new active pharmaceutical ingredients, APIs, become available to the NHF program for the treatment of the disease. In other words, you will see new drugs coming on stream and being available to those persons for treatment. These new benefits will take effect on October 24th, 2023. So we're not making an announcement for too long in the future. I don't know what today's date is. I've lost track. Today is the 24th. Okay, all right. So that's also very good to note that it is with immediate effect that these are going to be on target. So today for us is a good day for the National Health Fund and for those persons in the future who will be affected by these conditions. We continue to be as responsive as we can. We don't always get it right, but we keep working to get it right. And I think it's important. I have a little call-in program, and from time to time people call in and say, boy, I go to this pharmacy and I can't get this drug. And from time to time, though, people call in and say, if it weren't for the NHF, I don't know how I'd manage. So it is a mixed bag, but for the most part, it's a positive position and positive response, which is a very, very good thing. I say one other thing before I take my seat. Last week, we launched the Know Your Numbers program campaign, which the NHF is very involved in, which essentially is a screening program intended to encourage Jamaicans to screen and to know their health status. And the justification for that is that too many of us don't know our health status until we end up in the accident and emergency room. We don't know we are hypertensive until we get a stroke. And I could go on and on. And the data coming out of that first execution of Know Your Numbers was quite instructive to me. We did about 450 screenings, 450 people, I should say. We did about 1,600 screenings. Obviously, some people did multiple. 99 of the 450 were referred to the doctors for follow-up examination, diagnosis, and treatment. In other words, what's that, 25% or thereabouts? 25% of these random people in Falmouth Square who came into the tents to get screened, not all of them doing all the screening, some doing multiple, some not, were told by the doctors that you need to go to the doctor tomorrow morning or else you will drop down. You're hypertensive, you're diabetic, you're something else. To my mind, it is startling but not surprising, because if you look at the mortality rate and the causes of death in our society, you realize that a lot of it is lifestyle related, and a lot of it, in terms of premature mortality, is a consequence of ignorance, not knowing your numbers, as they say. And we have to intervene and disrupt that trend. And the way to do that is to motivate and incentivize people to get screened while we provide treatment. I've been to health systems elsewhere in the world. I was in one particular state in the US where I was visiting a cancer unit in a health system, and they were saying that mortality rate has gone down, even though cancer rates continue to go up. And the result of that, or the manifestation as to why that is the case, was through early detection. You detect early, you treat. We have to get Jamaicans to recognize that the phobia or the fear about going to the doctor for a checkup, I'm using the most parochial term now, right? Go get yourself checked up, is not to be feared. It's supposed to be viewed almost as a life-saving activity, because early detection means longevity of life, more life. And that's a narrative that we have to almost indoctrinate our population with. We need to say it more often. So I'm very happy for the Know Your Numbers program. This is, I think, next week or a week after we're in Linstead, then we go to Junction. And we're going around the country to encourage people to screen. But I think all of us should participate, be involved, and to encourage in our immediate setting the need for screening, corporate people and others, because that's going to be one of the ways to cut down on the overcrowding, the accident and emergency. People end up there because they have an emergency that they never know about. That's why it's an emergency. And I believe we could see 30, maybe more percentage cut in the A&Es if persons knew their conditions and were taking appropriate action and pre-planning to deal with it. We will never build enough hospital beds, operating theaters, or have enough nurses and doctors to treat runaway illness in our population. It's just not going to happen. You can criticize me or the government as much as you want. We can expand to a point, but if we don't control the demands on the system through prevention, it's just not a workable formula, no matter how good you think NHF is. And they are good. It is just a difficult task. But today is a good day for the reasons that I have said, and I want to thank the NHF and the team for the work that they have done. Thank you.
Thank you, Minister. I believe, that the Minister's announcement this morning is the largest number of conditions added at a single time to the NHF card since inception. 5 conditions. So we're moving from 17 to 22. Let's have another round of applause for that. I'm going to invite Mr. Jones to join us at the head table. We'll be opening the floor for questions from the media and attendees, and you'll have an opportunity to pose your question. No, Ainsley, just come right here. Yes. You don't want to take your seat. No, just being a ladies' gentleman. Okay. So you can pose your questions to the minister, Mr. Anderson, Mr. Jones, and Dr. Mars as well. So we're going to open the floor now, but just before we do so, I would like to extend welcome to Mr. Stephen Chen from the Diabetes Association of Jamaica, one of our partners who have been with us for a long time, and with him, Tasha Gray Henry. Thank you all for coming. And she came in late, because she's always working so hard. We thought she would have missed the press conference, but we want to acknowledge our Senior Director of Finance and Projects, Mrs. Shelley Solomon. Welcome. All right, so the floor is now open, and we'll take questions for the minister, Mr. Anderson, Mr. Jones, and Dr. Mars. Who is going to go first? All right, everything was clear. Did you put your hand up? Yes, please go ahead. Please identify yourself and go ahead with your question.
Monica Taylor of the Jamaica Multiple Myeloma Support Group. One of the happy troops. So we are very happy to be finally on the list. So thanks. But I have a question about screening, what the minister referred to as screening, which might not be so easy for some conditions. You can't really screen for multiple myeloma as such. What we know is that the executive profile, which is very expensive, gives an indication as to whether something is off. So is there a plan to expand the available testing sites? Because that can be a problem, I hear people complaining about equipment not being available and so on all the time on the radio program. I listen to it every Friday morning.
Okay.
So that was a minister's question.
Okay. Minister, I'm afraid you have to come up, Minister, because
Okay, thank you very much. The public system, once you are given, once you go in for a screening of some kind, the doctors tend to use their clinical judgment to determine what kind of follow-up tests are required. And the public labs do provide most of the tests, but I agree with you, sometimes it takes longer than normal. And normally those tests are done based on some sort of symptoms or suspicion or your description of your particular condition. So it's not that it's not available, it's a context of your circumstances and the doctor's own judgment. I don't know if there's going to be a system that allows you're just requiring a test and just getting all the tests done. Not right now. That could be quite expensive. Some of these tests are very, very costly, so I have to give you the naked truth, if there's such a terminology. But the system does allow you for that kind of assessment based on the doctor. So what I would say to persons is if you have an issue, you visit the doctor and you make a claim, and have a discussion and allow the doctor to deal with the circumstances. I think that for now is what we know. There are other NGO agencies that you can go at minimal cost and get some of these screening tests done. The Cancer Society and so on, that does these tests at much reduced cost, and those are worth exploring also. Okay, so that's what I would say for that. Are there any other questions? You don't mind me just, rather than going back and forth? Yes, Madam Henry. Huh? Oh, it's not for me. Okay, good, excellent.
Morning, Edwards Henry, Nurses Association. I notice we are gradually putting the cancers on, but as a nurse at the largest women's center in Jamaica, Victoria Jubilee, where we are seeing a lot of ovarian and cervical cancers, are there any plans afoot to probably, and cancer treatment overall is, as you said, Minister, is very expensive. Are there any plans afoot to add more cancers as we go along, specifically ovarian and cervical?
Thank you. We assess annually, but a lot of what we can do would be driven directly by our revenue, because cancer care is very expensive. And what we've seen is costs ranging from a low per patient of 2 million, that's over the last 3 years, up to 23 million per patient. So we will continue to assess. We did this at this time because Mrs. Solomon and her team went through a process that told us that we could sustainably afford this. So Mr. Jones here goes through a process every year where he assesses it. And what I can tell you is that we have maybe about 15 or more conditions being looked at now. So we will look at it, and as the revenue increases, then it becomes a possibility. Yeah.
Good morning, Stephen Della Penna from the Jamaica Association of Private Pharmacy Owners. And I have a question. I know we're gathered here, and I remember as I look on the list, as this rheumatic fever and sickle cell added, and I remember being at the launch of that. So congratulations for this latest addition. But I'm not asking about these, and the minister did raise this one. So I'm going to ask a question about know your numbers. Is there any contemplation or any space you see for involving private pharmacy in that campaign, in the Know Your Numbers campaign?
Thank you. So they are already involved, and we welcome others. First of all, the principle of partnership is something that we continuously promote, because health is really everybody's business, and we don't make a distinction between private and public, except perhaps from an access standpoint. Whoever provides a service towards health care, we incorporate them under the same umbrella, and similarly, the other partners who are not purely clinical, but support the initiatives. So the Know Your Numbers has a component of it. You have a copy of the card? The Know Your Numbers card? You don't have your wallet on it, no? I don't have mine either. All right. Yeah, it don't make sense carry my wallet, because nothing I did it. No, it's bad for you to put it in the back of your pocket and sit on it. You know that, right, men? All right, so we have a card, a Know Your Numbers card, which is a discount card that we actually launched with the campaign, the first execution, which if you do tests, you get points on the card, and you can redeem the points against purchases at selected locations. I believe there's a pharmacy chain involved. What's the name of them again? The Mustard, Fontana is there too. And the PB's got, Facey. Value Drug, yeah, Value Drug. There are other, who are some of the other people involved? Megamart. There are about 8 or 9 locations across the country. Max's department store and so on. Island Grill and all that. So what we have done is really try to incentivize screening. So that's one way. So if your pharmacies want to be involved in it, then it's good for you because it's a loyalty card. It's like the other loyalty cards. The health data resides only with NHF and the ministry. So those who are managing the loyalty card aspect don't have access to people's health data. But the other partnership is the screening of the actual execution of screening. So we have 2 approaches. We have the larger town center screenings, and then we have the mobile health clinics, some know your numbers, trucks. We've converted some of the COVID buses into screening trucks, and they will go into the malls, the plazas, the small communities, and do execution around incentivizing screening. From the drug dispensing standpoint, as you know, we have the public-private partnership. I don't know if you're a participating pharmacy, but we do drug serve windows in those facilities. So those for me are 3 ways. One, engage the mobile units if you can't do the big thing and bring it to your location and plan something that gets your customers knowing their numbers on a particular day that we support together. 2, the discount card to incentivize persons. And thirdly, of course, the drug serve window. And that applies not just to pharmacies, but to any of the other players. Thank you.
Oh, go ahead.
Godfrey Taylor from the Myeloma Support Group. I do note that with the illnesses or the conditions that are covered, not every drug that is applicable is necessarily covered. How soon will we know what drugs are covered for these 5 new conditions?
All right, thank you so very much. Yes, indeed, you're correct that not all the drugs are covered at this time. What we try to do is to ensure that we look at the treatment for the conditions and the major agents that are used to treat these conditions. We ensure that they are added. However, as our CEO indicated earlier, we tend to do reviews annually. And so we'll review, and as he indicated as well too, if the budget allows us, we'll definitely add new agents to treat the diseases. All right?
There's just one addendum to that. Sometimes something that affects you in one disease also affects in another disease. Because that particular condition is not covered, then you can't get access to some that particular side effect or symptom. That's something I'm suggesting that you look at. That's something I'm suggesting that you look at, especially as there are symptoms in multiple myeloma and some of the others that are in some of the other conditions as well.
Yes, it's noted. What he's speaking of is the comorbidities, and indeed, it's something that we'll look into.
Just to say that you can always see the list of drugs that are covered for each condition on our website. And if the new ones aren't there as yet, they'll be there before the day is out. Okay. Also, the new application form is on the website as well. And we have the new designed form here with all the new conditions added. We do have some application forms here for that, but it's on the website. It can be downloaded and taken to your doctor, and we will be distributing the new forms across the island. Any other questions? Yes, the president of the Pharmaceutical Society of Jamaica.
All right, good morning, everybody. Master of Ceremony, Minister, CEO, other panelists, everybody. So I hear the question posted by Stephen, and I listened to your response, but there is another element to it because pharmacies. We have about 535 privately owned pharmacies across the island. And, you know, pharmacists are highly trained persons, and we do this screening every day for our patients, the blood pressure, the glucose testing, and what have you. And I think we have actually referred several of our patients to seek medical help based on what we're finding. So the question that you asked, I would want to know, how can pharmacists collaborate with you on this program, Know Your Numbers? Because we are actually collecting the numbers, we are seeing the numbers as well. So it's not just about the benefit card, but we want to be active participants, right? And the other thing further to that is next month, between the 19th and the 25th of November, we celebrate National Pharmacy Week, and the Pharmaceutical Society will be spearheading a lot of activities across the island. All the healthcare facilities will be having healthcare. Our ambition is actually to have a health fair in every parish for that week, right? And this is a brilliant opportunity for us to partner with you and to expand and to expedite the collection of numbers. So we want to hear how we can collaborate and as we move forward. And just want to commend the National Health Fund. Wonderful job. It's the most efficient government agency that I've dealt with. Just want to keep it up.
I hope you don't say that when I call a meeting of the Ministry of Industry, Investment and Commerce. You know. Do I know you from somewhere? Oh, you never went to UA?
Yes, I
Okay. You did marketing at UA?
No, man.
Oh.
But we had a conversation about the electronic dispensing.
Okay. All right, you look like one of my students. That's why I was asking the question. All right, so what I'm going to do, because I think it's a good idea, the pharmacies are a critical distribution point across the country. I think we could explore what other things can be done, certainly in terms of the screening. So I'm going to ask Everton to have a discussion with you guys and to include the coordinator of the Know Your Numbers program, Mr. Vita McLaren, to just explore if we could establish some sort of, maybe even for Pharmacy Week, that week where everybody comes into a pharmacy, we have a kind of protocol around screening, and we do at least the basic ones and see if that could work, and then upload that information into the system, because I know that there is the ability to create the data flow between the pharmacies and the NHF. So yeah, I'll ask that. I think that's a good idea, and with suggestions are always welcome. Thank you. Similarly for the week, if there's anything that we can do to promote it, because I think it's a brand or a concept or activity that we need to. And we do have a target of 500,000 screenings over the next year. All right.
Good morning, everyone. This is not actually a question. Okay. I just want, on behalf of the suppliers, pharmaceutical suppliers, I just want to commend the National Health Fund on this launch. Earlier when I came in, I was speaking to the award-winning CEO. And I was saying that apart from the fact that a lot of Jamaicans will benefit from a personal point of view in terms of the role that we play, it takes a lot of pressure off the suppliers. Because for the pharma companies, access is a buzzword, and I'm sure Mr. Anderson and his team, access is the new buzzword. And they come and they're asking about access, and how can you lobby the government? And, you know, every week we're in this discussion as to how can we get more diseases added and so on and so forth. And, you know, over the years, we've always been saying, no, it's just breast and prostate. So I am relieved and I congratulate the team, and I feel proud because I can now say to the overseas manufacturers that, you know, the Minister of Health, the Ministry of Health, the NHF, they are responsive and they are listening and they are adding as long as they can afford it. So it is very, very good news for us. And so, you know, on behalf of the distributors, I want to thank and commend the NHF for this.
Thank you. Thank you very much. I think that's it. Okay, we have one more question, and we will take that question. So I think we'll have to hear from Ms. Aking.
Good afternoon, good morning. I have one challenge in terms of the deaf community. How many of them can go to the offices that you have for help, and how do they access the information without challenges? At the NHF, my challenge is that we let them know the information, and when we do let them know the information, how do they connect with the NHF? How do they get that information? When you're doing the tours, how will a deaf person access that screening that you're provided? Will you provide access in their language?
Okay, so I think that it's going to, we have a program now called New Limb, New Life, which is a limb replacement program. And I'm raising it because I think it applies to the question that was raised. So this is a program that seeks to provide support for persons who have lost a limb, 95% of whom are diabetics, losing their arm, leg, because of diabetes complications. But what we have done is partnered with the Disabilities Association. This is a unit based at the Ministry of Labor, and work with them very closely to screen and to determine, in conjunction with the medical team, the beneficiaries of that program. While I do believe that some of the agencies like the NHF can perhaps afford to put the necessary personnel in place to deal with the deaf community, I think what we need to do is to work closer with the organizations that represent the community and try to work out an appropriate solution to that. And I'd certainly encourage that, as Everton was saying, that they actually do that now. But I raised the New Limb, New Life program because we're not involved in determination as to who benefits and so on. We just leave it to them, put a protocol in place, let them work with their community, and we provide the resources. And I think we probably should do some of that also in terms of this particular case.
Thank you, Minister. And just to say, taking the lead from the ministry, the NHF, I think earlier this year, the board approved a program for improvement of customer service to persons with disabilities. We worked with the Jamaica Disabilities Association. We had several focus group discussions with the group to hear what the concerns were. And we have a cross-functional team at NHF, customer service, drug serve. We're currently looking at ways in which we can better serve the community of persons with disabilities. And what we're doing this morning is a part of our strategy to reach that group, to ensure that their representatives are here, that they know what's happening. We will be upgrading our website to ensure that information is there for both the deaf and blind that they can access. And we're putting a number of things in place to serve this community. So we want to thank you for coming this morning and ask that you would also pass this information on to the community. And we'll hear more about what it is we're doing as we implement these strategies. Thanks again. So ladies and gentlemen, I think we're at the end of this important conference, the addition of 5 new conditions to the NHF card, bringing the total number of conditions covered by the NHF to 22. We hope that the information shared today will have a positive impact on the lives of many, and we appreciate your presence here. We want to, of course, thank our minister who made the announcement and shared important insights into the expansion of the NHF card, which will undoubtedly improve the quality of life of countless individuals. I'd like to express our appreciation to all the speakers, performers, and the diligent members of the media who are committed to disseminating this vital information to the public. Thank you. Also want to say thanks to Ms. Sharon Jones and her team for organizing today's press conference. And on behalf of everyone involved, thank you for your presence this morning. Have a wonderful day, and may we all remain committed to the cause of better healthcare for all. Thank you, and please join us for refreshments before you leave. Thank you. Just to say to the pharmacy owners that pharmacists can, in fact, offer the HbA1c test to diabetics, and we do have a number of pharmacies on the program who are offering this test as well. Thank you.